The main effects of skin cancer are caused by UV radiation brought by the sun. Exposure to the sun is the biggest cause in developing skin cancer. Chemical structure within the skin forms in the tissues of the skin. Basal and squamous cell cancer forms in the cells that don't make pigment. Skin cancer is usually found in the sun, exposed to parts of the skin, such as the face, lip, ears, chest, or arms. Some products that can cause skin cancer are tanning beds and even doing your nails at a salon because you're exposing your fingers to UV light when it dies. Some serious effects of skin cancer include heart issues, blood clots, liver, lung, and eyesight problems. Skin cancer and its treatment hurt economic resources and opportunities for patients, families, employers, and society overall. These losses include financial loss, morbidity, reduced quality of life, and premature death. The way climate and environment can impact skin cancer is through sunlight. Exposure to sunlight increases the risk of developing skin cancer. How does cancer affect our health? The reason being is that everyone has cancer cells inside of their bodies. Cancer can press on nearby nerves and cause pain and loss of function of one part of your body. To the right, we have a chart that shows the nationalities most susceptible to skin cancer. At 9th, we have the United States of America as compared to 14 other countries in this world.
Physiological events that are compromised due to skin cancer are dry skin, itchy skin, skin rashes, changes in skin color, pressure sores, and scars and wounds. Dry skin occurs when the layers of your skin don't have enough oil and water, causing it to become rough, flaky, and red. Common causes include dehydration, hot and cold temperatures, poor diet, and side effects of cancer treatment. Itchy skin can lead to skin sores and infection. Common causes that lead to itchy skin are dry skin, allergies, side effects of cancer treatment, and medication. Skin rashes could develop anytime during or after cancer treatment. Your skin color can change due to tumor growth, sun exposure, or side effects of cancer treatment as well. A person may look redder than others because they have skin issues. Pressure sores develop when the blood supply to a body area is stopped. These are common in people who are bedridden and wheelchair bound because they can't move. Scars and wounds occur when the body is physically injured. After the injury has healed, it becomes a scar. Pathologies caused by skin cancer. In this case specifically, skin cancer is caused by repeated and unprotected skin exposure to UV rays from sunlight, as well from sources such as tanning beds that emit UV rays that can damage the DNA inside skin cells. The main types of skin cancer are basal cell carcinoma, squamous cell carcinoma, Merkel cell cancer, and melanoma. Basal cell carcinoma begins in the basal cells, and it is the most common form of skin cancer. Squamous cell carcinoma is the second most common form of skin cancer, and it is caused by an uncontrolled growth of squamous cells. Merkel cell cancer is rare and appears as a bluish-red nodule. It develops mostly in older people. Finally, melanoma is the most serious of the skin cancers because it spreads to other parts of the body more rapidly. It begins in cells called melanocytes that are responsible for producing the pigment of the skin. These are some examples of what skin cancer looks like. Skin cancer incidence rates. The chart to your left displays age-standardized world incidence rates per 100,000 for non-melanoma skin cancer in males and females of all ages. Blue represents males and pink represents females. To your right, the chart displays melanoma skin cancer world incidence rates per 100,000 for both sexes. The darker regions on both charts signify the most amount of cancer incidence. This data is from 2018. Prevention methods. Not only is it important for you to wear sunscreen, but consuming a healthy diet can make a difference in reducing the risk of developing skin cancer. Dermatologists recommend consuming a diet rich in vitamin C, E, and A, zinc, selenium, beta-carotene, omega-3 fatty acids, lycopene, polyphenols, and other antioxidants to help prevent skin cancer by fighting off free radicals. These nutrients can be found in nutrient-dense foods like fruits and vegetables, and it is preferable to consume them as whole foods rather than taking individual vitamin supplements. Methods individuals should employ to decrease skin cancer. UV rays from the sun can reach you on cloudy and hazy days, not just on bright and sunny days. These are some methods individuals should employ. Seek shade, cover up, use a broad spectrum of UVA, UVB sunscreen, prevent sunburns, avoid tanning, examine your skin, and consult with a dermatologist. Seek shade, especially from 10 a.m. to 4 p.m. when the sun is the strongest. You can cover up by wearing clothing that covers areas exposed to the sun and use UV blocking sunglasses or other products containing SPF like lip balm. Use sunscreen. For example, wear an SPF of 15 or higher every day. For outdoor activities, a water-resistant SPF of 30 or higher is recommended, and remember to follow instructions for reapplication. Prevent sunburns. Place an ice pack on the area or apply aloe vera and moisturizer, and you will relieve some of your pain. Avoid frequent use of UV tanning beds and long-term sun exposure. Examine your skin by checking it every month for any abnormal moles. Lastly, consult with a dermatologist at least once a year for a professional skin exam. You want to make sure you don't miss anything. Testing tools used to test for cancer in our community. Most melanomas are brought to a doctor's attention because of signs or symptoms a person is experiencing. Your medical history will be asked, and a physical examination will be conducted by your primary doctor. If skin cancer is suspected, you will be referred to a dermatologist. These tests are usually conducted by dermatologists, and they include dermatoscopy or dermoscopy, a skin biopsy, shave biopsy, punch biopsy, excisional and incisional biopsies, optical biopsies, and imaging tests. These will indicate if the melanoma has spread to other areas in your body. This is a warning sign guide you can follow to detect if you may have melanoma. However, it is always best to visit your primary doctor or dermatologist to be safe. Here you can use the ABCDE characteristics shown. A is for asymmetry, B is for border, C is for color, D is for diameter or dark, and E is for evolving. What areas should we test for in our community? Based on the charts we saw earlier, we should test areas that have higher chances of developing skin cancer due to long-term sun exposure. These places include the United States, Canada, Brazil, parts of Europe, and Australia. This picture provided by the CDC shows states with the most and the least cases of skin cancer. Although Florida does not have as many cases as other states, many people in Miami like going to the beach to tan, increasing their risk, making it a crucial area to test.